Wellness. This is the Wine and Wellness Week number 101, and this is a special event. We will be here live all day today and all week, going from March 4th through March 11th. I'm your host, Jamie Dorley, with the co-host, Joe Messino. Welcome back, Joe.
Welcome back, everybody. We got a full house today. This is looking good, just like the old days.
And just when he thought he was getting out,
we pulled him back in.
Straight out of retirement. Retirement from what? What are you retiring from?
Having a good time here.
This is a pioneer in the field of functional medicine, a graduate from the very prestigious Duquesne School of Pharmacy going back to 1976. You're like Doogie Howser, you're a little kid at school. And he's been helping people not only in the Pittsburgh area, but also in Peachtree City, Georgia, and now his new home of Tampa, Florida.
Amen.
Dr. Len Brancewicz, welcome back.
Well,
Dr.
thank
Len.
you. I'm enjoying myself. It's exciting. I've already seen a couple dozen people that I haven't seen in 10, 15 years. It's good to get back in the area. It really is.
So a lot of familiar faces and some new ones. Always we would like to meet new friends as we're on this mission to continue making the world healthy, one person at a time. So Len, maybe you can share, because you have quite a journey. We're going to talk about the journey from allopathic to functional medicine, but maybe you can share your journey, because you had a similar one as a professional, right?
Exactly. And mine came, as I said earlier, on my own health at age 39. When I found out I had serious cardiovascular problems, I was given 6 prescriptions and I couldn't tolerate any of them. So I ended up with seizure disorders, and I said, enough's enough. Decided to go back to school, figure out myself, use myself as a palette so that I could learn various techniques. And that walk has just been amazing. Met Jeffrey Bland, met Jim Laval, a lot of the pioneers over the years tutored us, basically, that we were able to sit down and chat and learn from them. And you put it all upstairs and you try to apply that. And then when you start working with people, it all comes back out. So it's been quite a walk, and I enjoy it. And the fact that I'm here at age 71, woo, much healthier than I was at age 39.
All right.
Well, thanks so much, Dr. Len. One of the things I really appreciated from working with you over the years is that you've always treated me like a colleague of yours. The learning has been both ways, back and forth.
Amen.
And you've been very generous with your time and your trust. So I want to say thank you. And here we are now. You presented this week in front of a room full of healthcare professionals in Tampa. I said, well, I'm sorry, in Ohio, all the way up from Tampa. I said, well, while you're here, you might as well stick around for the walk.
Exactly. Right? And I wanted to see it firsthand, because I hadn't been here for a couple of years, and to see the remodel and to see the people and to see the staff. And I am just, I got to say, blown away. I mean, it's amazing.
It's an open house all week this week. We have a lot of opportunities for you to participate, Joe. So what's the best way people can join us?
Well, first of all, you got to come on down. I mean, you can always call, you can always email, but we've got a whole week here. It's Saturday to Saturday. Come on down. We're here at 2419 Baldwick Road because you want to experience the whole wellness energy that's going on.
Yeah, you get to check out the workshops. We have a new therapy room, which is open and free this week. So if you're sitting here waiting now and you want to get in and try some of the free therapies, you can participate. We got the sauna. We have the vibration plate, which helps with lymphatic and weight. And we also have the Normatec boots that help this young lady right here. You had numbness in your foot earlier. And after 10 minutes, how'd you feel?
I felt lighter.
There you go. 10 minutes, numbness in her foot to the circulation's back.
Pair of legs.
And those are all free this week. We want you to have a wellness experience. Also, we got free healthy food. Mr. Z and his 5 daughters are out there helping us with the food truck. So you can go out and get some free food.
And that's why Mr. Z's still there, because of the 5 daughters.
Oh, yeah. He works 8 days a week. He cut back on his schedule. So you never know. Some people have 2 daughters, some have 3 daughters, some have as many as 5 daughters. You never know, Len.
And we're not going to go there.
Well, I'm blessed that I only have 2 plus the wife, so that's enough. But no, we have a good time down here too. We always like to break bread and see some old friends and meet some new ones. And we got the new sampling line, so you can take advantage of all the samples, smoothies, and all the healthy treats. So, Len, I know this topic has been really on the top of your mind. And the reason why, if you look at it, we have really a sick country, right? We looked at the stats, 5% of the world's population consuming over 50% of the world's medications. We rank number one in cost of healthcare in the U.S. But when we look at it, the healthcare system is ranking 37th, and our health is 72nd.
It's sad. It's sad, and just you go into that, number one in the world in medications. Let's just look at antidepressants. It's estimated now that 82% of females, not being sexist here, over the age of 40 are either on or have been on an antidepressant. What's that tell us about our population? That less than 20% are able to avoid that pathway. Raising children, raising a family, maybe working 2 jobs, etc. But what did we do? Instead of trying to find a more holistic view for support, we went back to the prescription pad and we tried Lexapro or Zoloft or Prozac. And then we liked the way it made us feel and we stayed on it. And
well, that's the
sad.
problem is a lot of times the patient is frustrated because the physician recommends an antidepressant. The person says, no, I don't feel good. I'm not depressed, right?
Exactly.
Have you seen that happen?
Well, yeah, and then they recommend them for so many off-label things. Oh, I'm having trouble losing weight. Well, here, have an antidepressant. At least you'll feel better about it.
But I found this was really fascinating. I know your background originally was oncology. Do you want to share this?
This is success ratio of a first-time pharmaceutical taking care of you, fixing the issue, whatever it is. I'm depressed. I'm going to take this. 27%. That's the success ratio of across the board. Now, let's add a second drug. That's the typical pathway the physician goes to. Well, if the first one didn't work, we either go to a higher dose or we're at a second one. Now we're up to 39%. And then if you teeter into the field of oncology without nutraceutical support, you're just going to go in, talk to the oncologist, chemo, radiation, surgery, whatever. 41% is our success ratio in the field of cancer. I'm going to let you share in that same field of oncology. If we add nutraceutical support,
it doubles, right?
Doubles.
That's what we need to look at is nutritional deficiencies as one of the big 4 underlying causes of any health challenge you're having, right? So you factor in toxicity. Those 2 becoming more and more of an issue. Then you look at someone's stress levels. Are those high? And then you factor in all the genetic predispositions.
That's right.
And now we know with certain nutrients or therapies that we're doing, we can biohack or circumvent someone's poor genetics.
Not only that.
All right, don't worry about it.
But not only that, Jamie, when you say toxicity, but the toxicity is being amplified by the very treatments. The drugs themselves are toxic.
First thing we think of, it's something in the air or it's in East Liverpool those are all big factors. It's in our water. But when we look at pharmaceuticals, that's a great point. Part of that toxicity is what is that pharmaceutical doing? We understand what's the difference. What's the basic core difference? A pharmaceutical interferes with the normal physiological process. Interferes. Nutraceutical enhances. Big difference.
Yeah, we're far from anti-medicine. What's happened is that they've gone to the medicine and surgery first. Then they come into the world of wellness 2 years later after surgery and say, oh, can you fix the colon?
That's right.
It's a lot harder to do. So I think we have to get the order back. There he is, Dr. Phil Ross. How we doing? So, this goes back to what my mentor, Dr. Bland, said, right? He said genetic determinism is a fallacy. He said at the very most, genetics is about 12% of the problem, up to 30, but you still have 70% impact, Len, in somebody's health. Is that enough to have a result?
When you brought up, I love that term biohacking. And when we look at genetic changes, can you literally go in and make a difference to your DNA? Can you make a change? Can you strengthen those little telomeres at the end? Can you make it feel better? Can you make it function better? Yeah, you can. And, to me, number one is glutathione. And to me, glutathione and glutathione levels, one of the most important and underutilized things that medicine has never looked at.
Yeah, why have they not recommended glutathione more? Because usually it's injectable, which is painful and expensive and inconvenient, or the liposomal glutathione. So, what are your thoughts on that, Joe?
I like my eggs fresh. I don't like anything that smells or tastes like rotten eggs, and that's what the liposomal does.
Yeah, so liposomal glutathione will actually smell like sulfur because it's a sulfur donor.
Yeah.
Right? So it smells like sulfur. So compliance is not very high on it, right?
No.
So generally people will try it once and they won't try
Never
it
go
again.
back.
So we have something now called Imodium, which is a PRT, a patented research trademark version of glutathione that is the most bioavailable on the planet. And we look at, overall, a couple of studies were done on this. Let's look at the first one. What they wanted to see is how much can we increase glutathione after it was depleted? So if you had a cup of water here and you deplete it, how much can we fill it back up? What they found is generic glutathione does about 50%. Not too bad. NAC did 66%, a little better. But when they gave the Imodium that we use in the greens now at Nutritional Frontiers and our Live Complete, the Imodium actually increased it 140%.
Anytime you get over 100%,
is the mic working?
Yeah, over
140%. It's supposed to say, wow.
The crowd,
going
listen to
crazy.
the crowd's going crazy.
Yay! 140% increase in Imodium that's in our greens and our Live Complete and glutathione levels. We didn't stop there though, because the other part is that's great. We increased it. What effect does it have on the liver?
Which is where the glutathione's made in the first place.
Right.
So they looked at inducing the liver with a toxin that would increase the enzymes because they got to work harder to clear the toxin. And what they found is that these enzymes on regular glutathione went up to about 5,500. On the NAC, 5,200. And on the Imodium, 2,300. So again,
unbelievable.
Twice the results when you use the Imodium. So proving that it's more bioavailable, proving that it supports liver function that much more. And we're in a time now where you can run, but you can't hide anymore.
No.
The amount of toxins we're exposed to is at an all-time high. So you need these super biohackers in your program.
I'll make a comment here about East Liverpool. Again, terrible that it happened. Terrible that there was a spill. Terrible that there was the exposure. Terrible that we're not going to know the full effect of this for probably 10 years. Terrible than the fact that it's in the Ohio River, which is a lot of the water sources for around here. And let me just say this, if we had every single resident of East Liverpool taking the greens, I don't think we'd have to worry quite as much. The body would be able to handle most toxic loads.
It would help it better and more, right?
Tremendously. But once again, these are the things that you would hope. Oh, the federal government came in and brought bottled water. How about if they came in and gave everybody the greens? That would save lives.
That's a great point, because the inherent problem with bottled water is, first of all, who knows where they bottled it from. But secondly, people only drink it. They don't cook with it. They don't bathe with it. So you're still exposing yourself to that water.
And you saw that I'm not from around here anymore, but Giant Eagle, it made the national news, had their bottled water coming from East Liverpool.
Yeah.
You didn't know that?
I do now.
Yeah.
Didn't
Their
know
bottled
that.
water came from East Liverpool. Yeah. So
I thought it came from the Swiss Alps.
Yeah.
No?
In East Liverpool.
Yeah. Okay.
Yeah.
Well, it's interesting. So when you look at that, those are some things that we're exposed to and we don't have an impact on it, right?
Right.
We don't have any say in the matter. However, what about the impact from just over-the-counter or prescription meds? And that not only the impact on the toxicity, but the nutrient depletion.
Mm-hmm.
And when people come in, oftentimes, the first thing I would do is stop the bleeding, meaning, hey, a lot of your new diseases are just side effects of the medication. So you can go through those a little bit.
Yeah. Let me just talk about the first one. When they made PPIs, the Prilosec OTC, go over the counter, you can go back to the day that the FDA decided to let that go over the counter. We're going to let that and Zantac go over the counter. Rates of stomach cancer and colon cancer have gone up 93%. We again encouraged individuals to suppress stomach acid instead of doing a balancing act like Probzymes. Instead of saying, let's just get rid of it, the complications of doing that are still being seen down the road. We can't keep doing that. When they put ibuprofen over the counter, which was fine, they did the 200 milligram, but people don't just take one or two or four, and we're getting stomach ulcers now from this, and we're actually compromising kidney function because of that. So you look at how many people are running into kidney difficulties now. All of this, when the FDA said, oh, these things are safe, we'll put them over the counter.
I want to ask you something about that, Len, because being a pharmacist, the connotation in the public's mind when something is over the counter, when they can go in and buy it without a prescription, the connotation is, oh, I'm not taking any drugs.
Right.
But this is not a drug. It's not prescribed. It's not illegal. I can buy it over the counter. So it's okay. It's not a drug, but it is a drug. I think that alone is causing the use to go up.
Well, and when I was doing one of my residencies at Piedmont Hospital in Fayetteville, Georgia, and I was in the Department of Pediatrics, we did a little survey, and out of all the discharges, whether you were there for surgery, cardiac surgery, a bone break, whatever, 92% of the patients that got out of there left with a prescription for a PPI. What do you need it for, doc? We don't know. It's our standard of care. When you went home, we're going to give that to you. So we started down that path. And again, you made a very good point. These are drugs. They are drugs.
Yeah, so one of the best things you can do if you're on polypharmacy, which is very common, right? There's actually no research safety studies on more than one medication at a time.
Combined, right.
So if you're on more than one or two medications, the first thing you got to do is stop the bleeding by stopping the nutritional depletion, right? Mm-hmm. So you got to replace the nutrients and medications depleting. We did a lot of work on this, and there's really four big ones, right? Vitamins, minerals, probiotics, and then CoQ10.
Yes. Exactly.
So we created these bundles. What's your thoughts on these bundles, Len?
Well, first of all, let's just jump to CoQ10 for a second.